Good morning, everyone, and welcome to this webinar from Pro Manchester on mental health and social distancing. I hope you all managed to join okay and are keeping well in these rather unusual but increasingly becoming more normal times. I'm Charlotte Lewis, and as well as working as a commercial health lawyer for Mills and Reeve in Manchester, I chair the Pro Manchester Healthcare Sector Group. This group is made up of representatives from across the sector, all of whom are absolutely fantastic. And I'd particularly like to thank Dan Morley, who's the Business Engagement Officer at the Faculty of Biology, Medicine and Health at the University of Manchester, for arranging a number of today's speakers. So on to the speakers themselves. I'm delighted to be joined by 4 superb speakers on this topic, who together will cover a range of diverse issues relevant to this particular issue. So first we'll have Kate McLaughlin from Euler Hermes, who will be speaking about how her company is supporting its employees' mental health and wellbeing during lockdown. And then Anna Callahan from TLC, Talk, Listen, Change, will explain who TLC are, for those who don't know, and how they support both perpetrators and victims of domestic abuse. And then we'll have Kimberly Dinas from, who's a clinical psychologist and lecturer at the University of Manchester, and she'll discuss some of the work that she's been doing around the psychological effect of the lockdown. And last but by no means least, we have John Vines, who's a professor in design at Northumbria University, and John will be talking about his work in human-computer interaction, and in particular digital technology and loneliness. Each of our speakers will speak for approximately 5 to 10 minutes, and then we'll have a Q&A session. So please post any questions in the Q&A chat box, and I'll facilitate questions at the end. So first up is Kate McLaughlin. So Kate is the International Event Manager at Euler Hermes. She has a particular interest in mental health and wellbeing, and is a trained mental health first aider and an active member of the firm's Wellbeing Champions. Of the firm's Wellbeing Champions charity and social media committees. Gosh, Kate, you're very busy. With live events put on hold indefinitely, Kate is focusing on various virtual projects and events to support staff through this unprecedented period, and is relishing the Learning Fridays Euler Hermes have implemented to encourage staff to use their time creatively and develop new skills if they wish. Since lockdown, Kate has helped to raise over £2,500 for Mind, and she'll be discussing some of the importance of looking after mental health and wellbeing within our now new virtual workspace, and we'll share some of the learning from Euler Hermes which you might want to adopt in your own organisation. So go ahead, Kate. Oh, Kate, sorry, I think you're on mute.
Sorry about that. I think, did Nicola mute me? Am I off mute? Can you hear me? Good. Right, thanks for the introduction, Charlotte. Good morning, everybody, and thanks for Pro Manchester for inviting me to join the call. As Charlotte said, I'm the International Event Manager at the company I work for, Euler Hermes. We are a large global credit insurer, part of the Allianz network. So we've got a large global network which benefits us in many ways in terms of initiatives and projects that we can all share globally. I produce all the events for the UK and the Ireland team, and work on regional events in Europe and internationally for our global brokers, global clients. What interests me that I've learned over the 19 years of working on live events is people. So I love people, I love talking to people, being exposed to different cultures, understanding how they learn, understanding what practices work for them, and then taking away what we can that we can apply back to our UK team. And I'm lucky that this career has given me the opportunity to weave my personal passion of wellbeing topics into the events we produce. So as well as having a business impact, they also have a wellbeing impact for our staff, because I think we need to balance that. And I'm very lucky I work for a company that recognises the importance of wellbeing in staff. If you don't have happy staff, you don't have a productive company. We firmly believe that, and we support them on various endeavours. So fast forward, that's in a nutshell. Fast forward from the last 20 years to about 3 years ago, and it makes sense as part of my role. I'm first aid trained because we have live events. Also, the company offered staff the opportunity to become first aid trained for mental health purposes if they wished. So that naturally felt something that I wanted to get involved in. I wanted to promote. I wanted to get other team members and colleagues on board. So I became a mental health champion. We started the wellbeing committee. There's about 8 of us in that committee. And I think that works really well because the company decided to open it up and invite staff to join. So firstly, that encouraged those staff that had an immediate knowledge or passion about it to get involved and to share their passion on various wellbeing topics. And then the opportunity to become a mental health first aider came about. That was a couple of years ago. We've been promoting it heavily since. We have probably monthly initiatives that we work on as wellbeing champions across all 5 of the wellbeing threads, and we promote various projects within them that staff can learn and develop from, or they can support on charitable initiatives with. So fast forward to lockdown, and obviously everything changes. We can't produce live events, we're not connecting as people. A massive disruption happened to staff in terms of having to work remotely. IT had to be moved remotely. So there were so many issues for people individually, depending on if they had dependents, depending on if they had younger children to support, depending on the age of those children, depends on the impact of how able you are to still deliver your working day remotely whilst trying to homeschool children. So we had a million different scenarios based on individual circumstances that we took a step back, we looked at, and we thought, how can we best fit and meet the needs of the majority to begin with, but then also look at individual circumstances going forward. I think globally, HR, I'd like to recognise them. They've been fantastic globally and in the UK and in the region. Just reinforcing and reminding staff of prioritising their own well-being first before they're worrying about stresses of work. Make sure you're happy in your home environment, make sure you're connecting to your friends, to your colleagues, make sure you're staying active when you can. And around those kind of key areas of well-being, we produced Learning Fridays. So every Friday, or any day if it works better in the week for you, we give staff the opportunity to undertake a plethora of courses: soft skills, technical skills, personal development skills, and a lot of them that we're focusing on are on well-being, resilience, stress management skills. So staff feel that they've got the tools that can help them through obviously the couple of months of isolation and disruption to their workload. Then we've offered them the chance to change their hours, to reduce their days, to work whatever they need to around those people that are dependent on them and their personal situation. So I think in terms of the support from company, that has massively helped staff in feeling a little less bewildered, and that they can focus on their personal health first, their family, and then once that's ticking over okay, then they're productive, obviously in the work environment as well. So we have launched various little initiatives around the 5 areas, just so it's themed. We've produced some incentives, we've produced virtual treasure hunts, quizzes, we've launched gardening clubs, book clubs, we've launched mentoring, we've created a little dynamic wellbeing video just to reinforce the areas and how important it is to reach out to your colleagues. To if someone's not looking or sounding or feeling the same as they normally do, take notice, reach out to them, take notice of your own behaviour, your own feelings. And we're really trying to emphasise that if you're looking after your well-being first, then everything else becomes a lot easier. So that's the kind of areas we've come from within Euler Hermes, and I think that's all incredibly positive. And I think, as I said, I'm lucky to work for a company that does support staff. We've also given staff a little thank you gift, all 350 staff in the UK, to thank them personally for how disruptive it was and how resilient they've been, and just to continue to obviously thank them for supporting and being dedicated to the company. And I think the important message here that we emphasise to them at every point is all the wellbeing material, everything that we're promoting, it's not just for now and it's not just for lockdown, and hopefully they will learn new skills or learn new I don't know, learn about themselves more, I guess, and be able to be better equipped to learn and adjust moving forward in their lives when perhaps another big disruption, maybe hopefully not on this scale, happens. And I think recognising and understanding your own mental health and being patient and kind to other people, I hope it extends beyond lockdown.
Thanks, Kate. I'm going to break my own rule, in which I said that I wasn't going to ask any questions because we've had one quick question, which I think it would make sense to discuss now. So Sam's asked how the virtual treasure hunt works.
Well, you need to sweet talk lots of technically skilled people in your company into supporting you, and promise that you will help them out on their next endeavour, because we actually themed it for Easter, but because of diversity and not keeping it towards one religion, we did the Egg Vengers Easter egg hunt. And we hid lots of little eggs decorated as the Avengers around our internal Connect system, which is our internal intranet for staff material and sharing initiatives, etc. And then we gave them a time limit, and obviously we hid them on the content pages related to the wellbeing topics we wanted them to read. And then they had a time limit, they had to go around the portal, find the eggs, prove that they'd found the eggs, and then they won a prize. So just a little fun initiative.
Sounds brilliant. Thank you. I'm going to feed that one back in, definitely. So next we have Anna Callahan. Anna is the Director of Services at TLC, which explains Talk, Listen, Change. That's a Greater Manchester relationships charity, creating and sustaining safe, healthy and happy relationships. For over 10 years, TLC have offered a range of services and programmes for perpetrators of domestic abuse, working with them to change their harmful behaviours. They also offer integrated support for anyone affected by their actions, which can include partners, ex-partners and any children involved. Anna's previous role within the charity was as Head of Domestic Abuse Services, supporting the delivery, management and development of the department. And Anna will today be discussing the kinds of concerns and issues that TLC know are now more prevalent than ever before because of lockdown, and explaining some of the support available for people who may be struggling even more now than usual. Thanks, Anna.
Hi, thank you so much for the invite and for all of your time. As a relationships and people kind of person who generally loves to engage with the people I'm chatting to, I'm not sure webinars are going to be my strong point. So please bear with me as this is my first webinar. But yeah, as Charlotte said, I'm Anna Callahan, Director of Services at TLC, Talk, Listen, Change. So here at TLC, we recognise the importance of relationships and the positive and negative impact that they can have on our mental health. Through our services, we want to be able to support people to create and sustain safe, healthy and happy relationships, enabling people to create a circle of support around them, building resilience in their relationships across all areas of their life. So that might be the relationship they have with themselves, with their families, their friends, partners, community, or even their employer and their work colleagues. We do this by delivering a range of services, including counselling for children and young people, for individuals, for couples or for families. We have a psychosexual therapy project, which is providing individuals or couples with support around their sex life. We have community-based volunteer projects, which includes Strive, which is an early intervention programme for domestic abuse incidents, which have already been reported to the police. Our domestic abuse department, as Charlotte already mentioned, includes a long-term behaviour change programme for perpetrators of domestic abuse, as well as supporting their partners, ex-partners and any children of those men or women who are accessing the programme. We also have a mediation service, which is a confidential process for separated couples to make arrangements for their children and finances. So the reality of relationship support in day-to-day life is that people have a range of coping mechanisms to support them in navigating both their healthy and unhealthy relationships. And the reality for many of us is that during this time of social isolation, that a lot of that support network or those coping mechanisms are either severely or in some instances entirely restricted. So negotiating respectful, healthy relationships can be difficult at the best of times, and this has become even more difficult with the uncertainty of lockdown, the added anxiety around or stress or pressure around health issues, finances, jobs, and all the while people are still trying to deal with the reality of relationships in lockdown, whether they were healthy or unhealthy before all of this. For some, it's the lack of day-to-day contact and loneliness that is having a massive daily impact on mental health. And for others, especially in the case of families experiencing domestic abuse, the prospect and the reality of living in lockdown with a perpetrator is unimaginably difficult. The nation's being told to stay at home and stay safe, but for many, home is the least safe place that they have. Thankfully, though, there are many both local and national organisations that are still available and still delivering support services, either remotely or in some instances using social distancing for those that are most in need. I will send a list to be circulated of all the kind of local and national phone numbers and helplines that are available for online phone and text support for partners, ex-partners and children experiencing domestic abuse. There's a massive range from Independent Choices, the LGBT Foundation, Survivors Manchester, Respect. There's a whole ream of them, so I will make sure that we send through all of them. There's also services, like I said, like ours, who are here to support people who are worried about their own behaviour. So Respect, which is the national organisation and our accrediting body who support the safe delivery of perpetrator work, have seen a 96% increase of calls from perpetrators looking for support on their helpline. So this is a time where not only people experiencing the impacts of domestic abuse are more worried and more anxious about what's going on, but also perpetrators recognising that this is a massive time of risk where the triggers they already had are heightened and they have less support networks and less ability to kind of do the things that they've been trying to do in terms of risk management and de-escalating risk. Domestic abuse obviously has devastating and long-lasting impacts and effects on mental health for all of those experiencing it. Domestic abuse can and does affect people across all aspects of society and within all types of intimate partner relationships. And here at TLC, we're passionate about ensuring that the services we offer will support long-term sustainable change by holding the right people responsible for their behaviour and accountable for the changes that are made. We absolutely are in huge support for all of the victim-specific services, but massively passionate about trying to end the cycle of abuse by addressing it with the cause of the problem, which is the perpetrators. Respect currently has a campaign that they're running, No Excuse for Abuse, which is a critical one. No excuse in lockdown, no excuse ever. Abuse is something that we have to tackle, whether we're in the restraints of this current situation or not. And there are agencies available to support if people are worried about their own behaviour or the behaviours of that of a friend or a family member. The emotional impact of lockdown is there for many of us, whether we've got a full house or we're isolating alone, whether we've got young kids or we're homeschool age kids, teenagers that are struggling or no kids at all, people who've been furloughed, who are having to work from home, people still working on the front line or not able to work at all. Some people are managing with new projects and crafts and hobbies and DIY, and others are literally just getting through on a day-to-day basis. There are, I'm sure, some really good points of isolation for some people, but also some really difficult implications for most, if not all of us, whatever our circumstances. So So I guess our shout out today is it's okay to feel both the ups, the highs and the lows of this strange and difficult time. But we also know that for many, this is putting an unimaginable strain on their mental health and their lives potentially. And there are people out there who can listen and support as soon as people are ready. And as an organisation, we've got all of the information that we will send about domestic abuse support, but also in terms of counselling or relationship support more generally, we can send you the information. We have been really lucky to secure some funding for free counselling for people who need it the most at this time. So again, I'll send out numbers for that if there's support that people think that either themselves or their family need at this really difficult time.
Thank you so much, Anna. I'm sure that people watching this now live or the recording will benefit hugely from that information. So thank you. It's a really important issue. And I feel, for me, actually, one of the points that you made is around helping perpetrators, which I think it's something that in any situation where we've got this, where there's a wrongdoer, as it were, more often than not, they're just seen as the bad person and not offered the right level of support. So you know, some people can be turned around, I guess, and that's quite important. So thank you for raising that. We've had a couple of questions, but I'm going to group them together at the end. So we'll do that. So thank you for those who published questions for Anna. So we're going to move on to Kimberly now. And Kimberly is, as I previously mentioned, clinical psychologist and a lecturer at the University of Manchester. And she works in the Division of Psychology and Mental Health, the Manchester Centre for Health Psychology. Kimberly's going to talk about the findings from her very recent research on the psychological effect of the lockdown. And I'm pleased to say I've just watched it. She's featured on BBC News very recently, so we're incredibly honoured to have you here, Kimberly, as a minor celebrity. So please, please go ahead. Thank you.
Absolutely, and please don't have any expectations based on that. That was my first experience on national television. I was definitely very frightened, but it was definitely an exciting experience as well, and just a really amazing opportunity to be able to share a little bit about what we've been doing. Just kind of in these initial stages of lockdown. And I'll tell you about that in just a moment, but I did want to kind of start out and say just a little bit about myself as people have been doing, and also just thank you for having me. I'm really honored to be included in this wonderful group of people who are just doing such fantastic things, specifically for mental health during social isolation and lockdown. We have a completely unprecedented situation here. This has never been seen. We have no idea what we're doing, and just having these wonderful people who are working on the individual level and group level to try to help people through it is something very special. So I'm really honored to be part of it. As you heard, I'm a lecturer in clinical and health psychology. I also direct the master's programs in health psychology and clinical and health psychology at the University of Manchester. And my research area is stress, stress and depression, stress and anxiety. So it's actually very relevant right now. I look at biological, psychological, and social factors involved in stress. There's a bio side that I won't bore you with, but I basically make people chew on cotton balls and measure the stress hormone cortisol. So that's the kind of biological side of things. Sorry, I had an interruption here. But the psychological and social factors are also very much involved. Hold on just one second.
Mommy,
sorry, this is a reality. It's a working at home.
But Mommy, I didn't go skipping Chelsea all night. I don't know where they are.
Sorry. Okay, we're back. We lost Skipper and Chelsea, but I think they're found. Okay. The reality is they're working at home. So that's the kind of biological side of things that I do, but I also look at psychological factors, and I was the director of a effectively ClinPsyD program back in the United States, and I'm a licensed clinical psychologist in the US. And here I've been doing research mainly in teaching at University of Manchester. So what we got involved with the University of Manchester Centre for Health Psychology in collaboration with Swansea University is a study looking at people's experiences of social isolation and lockdown. And there's a great deal out there right now, which is really exciting. People are really getting involved in this. We were all fortunate enough to start very early. So we started talking to people in basically weeks 2 or 3 of lockdown, and we ran 5 focus groups and spoke to people from a wide variety of backgrounds, was what we were really trying to capture. So some of our individuals that we recruited had lost their jobs, were isolating by themselves. Some had had to move back home with their parents. Some had to basically kind of engage in really kind of active trying to get food and just basically get by. We also had some people who were kind of at the other end of the spectrum and actually very happy to be at home with their children who usually have to travel for work, who are actually kind of enjoying lockdown as a time to bond with their family, and who had quite substantial resources to be able to kind of engage in activities and be able to get outside and have green spaces. So we really had that wide range, and something that and I'll share the results with you in just a moment, but I think that's something to really remember, and it's something that has already been spoken about, that there is such a huge variety of experiences of lockdown. I think you said it very clearly, Anna, that everybody has some negative experiences, but people are having such extreme differences in their experience, and I think our focus groups capture that. What I want to highlight kind of with the differences is also some really 2 important themes that we found in talking to people, and these are not going to be surprising, but they came through very clearly, and hopefully I can talk about them in a clear manner. One of them is uncertainty. Everybody was suffering because of the uncertainty. I study acute stress research, and one of the most salient features in why something is very stressful, the thing that makes your body respond hugely when you encounter a stressor, is uncontrollability or uncertainty. Okay, so a lack of control and not knowing what's going to happen basically makes your body go haywire. Okay, and psychologically it's impactful as well, and we're really seeing that because people don't know when it's going to end. People don't know what's going to happen in the future. People have had their control taken away from them in a way that has never been seen before. So this loss of agency, this loss of control, and the uncertainty is something that is impacting people across the board. It doesn't matter socioeconomic status, resources. This is really impacting all of us. And I've seen in my students, I'm an advisor to a lot of students, they speak about this. It's really impacted their concentration, their ability to focus. I don't know if all of us have seen this, but really your ability to focus on tasks, because there's such a cognitive load. Like in stress processes, we're basically all running away from lions all the time because we have this cognitive worry that we're dealing with on a day-to-day basis. And I think we're seeing a lot of effects of that. People have talked about being tired and they don't know why. People have talked about being incredibly sad, symptoms of depression and anxiety coming out after even 2 weeks, because we're dealing with such a significant, uncontrollable, event. The other thing that people spoke about was a loss across different areas. So at a kind of physical level, a fundamental loss of resources, loss of finances, loss of space, and then a loss of structure was something that came about really clearly. So people are really suffering because of a loss of structure. Normally you wake up, you go to work, you come home from work, you have these markers to your day that are no longer present. And people were really suffering because they had lost those day markers. They're trying to create their own structure, but that's actually very difficult, I think. And speaking as a mother, as you saw there, children are also suffering from that. I think they have these kind of schedules, they have these routines and boundaries, and they're really struggling because of the loss of that along with their parents. And then there was kind of some themes of loss that were actually more emotional, and the reporter Jenna for BBC News actually put it a really good way. It's existential in some ways, and that is kind of a loss of meaning. So people have talked about not knowing what to do next, feeling like everything they do is useless, kind of trying to find some sort of meaning or some sort of reason for doing what they're doing. And a loss of self-worth. Actually, a lot of people feel that, and this is especially obviously those with the loss of job, that people just kind of don't feel very good about themselves. right now, because they don't know what they're doing next. They don't know what's coming next. So it's almost like these physical losses that they've experienced kind of lead to emotional losses. And everything that we heard really hit home this message, and that is that mental health is going to be impacted hugely. Resources need to be directed to mental health. We need to work on our telehealth. We need to work on our ways to bring therapy to people in their homes. We need to expand our ability to give counseling to people to help them access resources. Because for people who are already suffering for depression and anxiety, the loss of control and the loss of structure is going to make it worse for the majority of individuals. This is just, these are two things that are central to depression and anxiety: the ability to control, the ability to structure your world. I mean, anxiety is basically, fear or a lot of loss, fear of, well, all sorts of different anxieties, but basically kind of a loss of control is very central to a lot of different types of anxiety. So I think it's going to be very triggering for a lot of people. And we see this over and over again already. What we're doing going forward is we're actually following up these focus groups at 1 month intervals to track the experiences of people during lockdown and after lockdown, really kind of in depth. We're also going to be sending out a survey to get kind of a more surface level, but a more general picture of people's experiences across the UK. So it's really a multi-method longitudinal study that we are going to be carrying on here. But I think the focus groups have taught us a lot, because even though it's speaking to a relatively small number of people, obviously compared to the population, you get an in-depth picture of what their experiences are. And I think that right now, as we're right at the kind of point where hopefully we might hear something from the government giving us a little bit of understanding of what's going to happen in the future, the message that this could really help people's mental health if we get something to hold on to needs to get out there. And I think at a policy level, that needs to be said, that people need something to hold on to. They need a little bit of control back, whatever that looks like, while absolutely recognizing the need for lockdown, the need for distance, the need for safety. So hopefully that balance will be something that's important here. So that's all I have to say at this point, but I'll look forward to questions, and thank you very much.
Thank you. Thanks, Nicola. Thank you, Kimberly. That was excellent, and I've got a few questions, but I will save them as I promised to, and then we're going to finish up with our final speaker, John, in just a second. But I think what John's got to say will actually sort of feed in quite nicely to some of the points that you've just made there, Kimberly, as well. So without further ado, John is a professor in design at Northumbria University, where he is based in the Co-Create research group. He works in the research field of human-computer interaction, and his research focuses on the study of how people experience, appropriate and use digital technologies in their everyday lives. His research has focused on a range of societal changes that technology has implications for, including independence in old age, social care in communities, and health promotion. And perhaps John can predict the future, who knows, but he's been part of an ongoing research project exploring the positive and negative impacts digital technologies can have on populations that are socially isolated, as we are all now, or at heightened risk of loneliness. So he's going to talk about some of that work that's been ongoing for quite a number of years already. Thanks, John.
Still on mute, you see. You can be a professor in human-computer interaction, but that doesn't mean you know what you're doing with these things. Thanks a lot, Charlotte, and hi everyone, and welcome to my daughter's nursery here in the not so sunny northeast coast of England. I won't say too much more about my background because Charlotte's done a nice introduction there, but I suppose one thing I guess I find myself in at the moment is a bit of a quandary, and I guess a crisis of identity in terms of my research, because of the nature of my research, the current situation both really sparks off my curiosity and interest, because digital technology seems particularly important and influential at the moment in terms of how we keep socially connected. But I guess also because of my research, it concerns me an awful lot as well. Just to give a bit of background, I worked on a project called Loneliness in the Digital Age, And this was done with a whole host of collaborators. And we've been conducting research for several years into the experiences different communities have of loneliness and social isolation. And as Charlotte has said, how digital technology can be both a negative and a positive factor when it comes to these experiences. Now, you find a lot of research actually around social isolation tends to focus on older adults, but actually we looked at different populations in our work. We focused specifically on groups who may be especially at risk of loneliness as a result of significant life events or particular disruptions to their lives. So we worked with people that are becoming parents for the first time. We worked with people who had to retire or to leave employment to care for a loved one. We worked with people who are moving from a team-oriented workspace to working on their own, which is particularly pertinent at the moment. And also we worked with young people who are leaving home for the first time to go to university. And in the project, we saw the ways in which people experienced a great amount of loneliness, often even when they were spending an awful lot of time with other people. But also we saw how even short spells of perceived social isolation can cause a great amount of anxiety, which would have long-term ramifications, particularly when there was quite a lot of uncertainty over when these spells of isolation might actually end. Now, my particular interest in the project was around digital technology, and I guess technology, especially social networks and instant messaging platforms, provided participants across all of the different groups we worked with an important means for keeping connected with other people. It supports being connected with loved ones while you're working alone, or if you're getting terms with fitting into a new home. It can enable connectivity with other people in similar situations to your own, where you can share advice and share experiences. And actually, even at times, just being able to see that there are other people out there that could be reached out to if you needed to was enough, even if you didn't necessarily have direct communications with them. But we also saw how digital technology came with a lot of problems, and how, particularly when you're experiencing anxiety from being isolated, it can become a bit of a crutch. Social networks often give a sense that if you post a status update, or if you send a tweet, or if you add a comment to a forum thread, then someone's going to respond. And that's not always the case. And this can lead to, an even increased sense of not being listened to, not being heard, and to being alone. It's also really easy to be led into making comparisons between yourself and others and increase a sense that you are lacking in some way. This is something we saw a lot among university students who are struggling to make new friends and new social connections, and also amongst new parents who are quite quick to judge their parenting abilities in relation to others. And it's a sense that actually everyone's experiences can be incredibly diverse, and social networks really do give a sense that people's experiences should be homogeneous in some ways and lead to these social comparisons. We also saw how one of the great powers of social networks, this ability really to be connected with others experiencing similar situations, can also lead to being immersed in misinformation, or being unable to reconcile quite disparate forms of advice or information, simply because these folks felt like they had no one else that they could talk to in person or to make sense of this information with. And in the case where we were doing research with lone workers, we also saw how technology was increasingly being deployed by their employers to mitigate some of the concerns around working remotely on your own. So we saw how organisations were putting in place their own social networking systems, for instance, rather than using the dominant ones which are available. So these technologies were useful in some ways because it allowed workers to be socially connected to their teams, to see how other people were doing in their work, and to have remote breaks with co-workers. But also these systems gathered an awful lot of information about their performance on the job. So we actually start to see how staff would purposely avoid using these technologies, even if it was to the detriment to their relations with some of their colleagues, really just to avoid being monitored by their employers. So this is kind of work we've done in the past, but if you come to the situation now, although, obviously there's a lot of things that are very, very different, and our work was quite focused on particular groups and populations, you can see still quite a lot of these tensions are being played out at the moment. There's obvious concerns with how misinformation about the pandemic is rife on social media platforms, which are having implications for how people make sense of the pandemic in their own lives and how seriously they take the social distancing measures. It's not hard to find examples of where social media is also being used to other certain groups for seemingly not adhering to distancing measures, which often do more harm than good, and also can be laden with assumptions and at times xenophobia. And there's all this emerging conversation going on around the NHS contact tracing application, and there's more research being funded into using social media as a source for understanding the spread of the virus. And I think going forward, debates around these will just lead to kind of more tensions really between the enabling qualities of mobile and social technologies and the potential privacy concerns and the impacts they might have on our personal freedoms. That said, I don't want to be entirely negative. There's some really positive endeavours going on as well. Something that's emerged from this space is the way technology is being used by communities at a hyper-local level. So we were seeing lots of examples of how houses and streets and neighbourhoods are kind of setting up WhatsApp groups in order to share information and to coordinate responses and, in a sense, provide a sense of solidarity around the lockdown measures. And how these are being particularly valuable as being in terms of getting groups that are connected online to be kind of identifying members of their local communities who might be particularly at risk, particularly vulnerable, or might be not able to access online information and materials. We've also seen how websites like nextdoor.com, which have existed for nearly a decade and really are really about social networks for very, very localized communities, which actually haven't been very popular over time, have suddenly got a renewed energy and a renewed purpose around them. So I think there's some potentially really positive examples where digital technology is enabling meaningful responses to the social distancing measures around the pandemic. And these are going to be particularly powerful at a hyper-local level, and perhaps we can learn about these going forward in order to kind of establish quicker responses using digital technology for future pandemics, if this ever ends. But we also need to be really cautious, I think, about seeing technology as a solution to the problem in and of itself, and really think quite hard about the types of social practices and social organisation that it might support instead. I think I'll end there, if that's okay, Charlotte.
Yeah, of course. Thank you very much. So we have a couple. Sorry, I'm just looking at the live Q&A now. We've got a couple of questions. I'm going to ask the question from Stephen Lyon first, because it's specifically for you, Anna, and then I'll come on to some of the other questions, and they sort of mix in with some of mine as well. So it's probably for sort of some of those are more general. So is Anna still on the line?
Yeah, sorry, I'm just back. I'm so sorry.
That's okay. So Anna, Stephen's asked, he says TLC sounds great, and but he guesses it differs from Relate, for example, in that it has a whole family approach and is focused on abuse in families. Is that correct?
Yeah, so we actually used to be part of the Relate Federation. So we became a wholly owned charity in April 2017. But yeah, we basically want to have, so we've got lots of similarities, but kind of some extensions of the work that we do. But yeah, where possible, we like to have a whole family approach to stuff. And we would never offer any support to perpetrators or intervention to perpetrators without having the integrated support package for the whole family, because while we want to hold the right people accountable, we absolutely want to make sure that the impact of the service and intervention is having a positive effect, and the way we do that is by communicating and assessing the experiences of those affected by the abuse, not necessarily from the perpetrator themselves. So yeah, where possible, we definitely want to address kind of the impact, both short-term and long-term, with everybody who's been affected by it.
Yeah, no, that's great, thank you. And then a couple of questions. So I had a specific question, I suppose, for Kimberly, and possibly also for you, John, you may want to pick in on the technology side of things. But Kimberly, you mentioned about resources, and that resources will need to be directed towards mental health. You know, we know there's been arguably significant underinvestment in mental health, and funding has to a certain extent been increased in recent years. But I'm particularly interested in the idea of telemedicine or digital mental health services. So I think views do differ, but I think it's probably fair to say that some people anyway consider the face-to-face sessions and treatment to be the kind of the gold standard, and the thing that you have to wait a long time for if you want it to be paid for by the state, and is the sort of and actually the telemedicine, or even the sort of the online services where you aren't even, you're not speaking to anybody, you're doing exercises online and that sort of thing, are again argued by some as the lower tier. I think that given where we are and the much more move at the moment towards digital health services generally, so lots of people now are much more familiar with seeing their GP online or having telephone appointments and that sort of thing. Do you think then that people will start to feel more comfortable with a more virtual or digital mental health service in the same way? Because I anticipate that the only way we will be able to resource that need is if it does move to so it's not just face to face, because it can't possibly be. We don't have the resource for that.
I think absolutely. I'm actually hoping that this will be an opportunity for mental health to move online more. I think that a lot of people haven't been able to access mental health resources because they live remotely, because they have transportation issues, because their issues are so severe that they might not be able to make it in. Actually doing something online could make therapy more available to people in general. I think, as you can probably tell, I'm American. In the States, there's been a lot of research into telehealth, and I know that here it's ongoing as well, specifically with different disorders. King's is doing some great research on telehealth interventions for IBS. I know for chronic fatigue, especially things that make it kind of hard to travel, to get in, to see someone. A lot of my research has been with depression. People find it hard to get out of bed. It can make it very hard to get in to see someone. This is actually an opportunity, I think, for people to see online help as more mainstream, as something that is possible. I know they're looking now into how they can move therapy online, into the kind of safe ways for people to talk without people being able to hack in and to kind of break into the conversation. So they're already looking into it. And the research really shows that it works, that it's something that can be very helpful. There's a lot of wonderful telehealth research out there that obviously I won't go into in depth. I myself, when I've seen clients and I've traveled, I've sometimes had to do sessions via Skype. So on a personal basis, is it the same as face-to-face? No. Does it have benefits that can actually be different than face-to-face? Yes, because it actually adds a little bit of a barrier that sometimes I think made it easier. And they actually said this for my clients, to talk about things when you're sitting right there with a human being might be a little bit harder. Do you know? I think it can actually make it a bit easier sometimes to talk. So there might be, I think, some hidden benefits for the mental health field in that online mental health is going to be more acceptable to people in general. And the research does show that it can work. So I'm hoping that that's where people are going to go now, and hopefully people will feel more and more comfortable accessing it.
Yeah, and that I think so too, and I really hope so. And John, is there anything on the sort of human-computer interaction that on the work that you've done that you think might feed into some of that?
Yeah, I mean, I would totally agree with some of the things that Kimberly's already said there, and I think just to I guess to add to that, I suppose as well as the kind of the unwillingness for whatever reasons sometimes to engage with, say, online therapies or interventions, both from I suppose the NHS side as well as from the public side. I think it's really worth remembering that actually there are probably vast, if not always particularly well evidenced kind of digital tools, apps and interventions that are already available on app stores, which even though quite often, and this is something from our research that we've been looking into, often these are not developed rooted in particular evidence. They've actually been usually developed by groups of people that have identified a lack in something, often from a personal experience. So I think we could also do some more work going forward in kind of curating, and I suppose I'm not talking about validating these apps that already exist out there, but we can do something in kind of bringing those resources together and doing a sense of kind of checking their quality and being better really at signposting folks to their availability, because it's kind of a really a resource. I guess I'm thinking in terms of kind of I tend to not, as you probably got from what I said, I don't tend to just think of the technology, but it's about technology, people and practices altogether. And I think one thing that shouldn't be forgotten is the huge importance of the charity and the non-profit and the community sector here as well, in supporting folks through these times and going forward. And certainly, massive issues around the investment and the financial resources around that at the moment, but I think also that in terms of a sector, that's probably the one where there's the most potential, but also the largest barriers to digital transformation. And actually there's probably needs to be some really focused work going forwards in terms of thinking not just about the kind of the NHS space and private healthcare space in terms of telecare, but also what are the types of things which non-profits and charities and community organisations can use to support folks, because also there'll be people that are much more comfortable talking to a charity and opening up with people that might understand their experience more than necessarily be seen as a clinical expert, but they can also really benefit from digital tools and digital platforms as well.
No, that's great. Thanks, John. I'm going to ask so a couple of questions, and they're sort of open to anyone really who wants to chip in, because I think that there may be some more of a sort of scientific answer, but then there may also be sort of more personal answers or from others. So been asked, and it's something that I'm particularly interested in myself, is that there's a dichotomy at play, and we're all now familiar, if not necessarily happy, with the idea of lockdown, but there are increasing calls for easing of restrictions. So how do we ensure the balance of these potentially conflicting messages so people don't feel even more at ease? So I suppose an example for me is that we've been talking at work about potentially when lockdown is eased, but we go into this new phase of sort of still social distancing and lockdown light or whatever it's going to be. Actually, I work in Manchester, but I live an hour away and I get the train. How comfortable do I feel about getting on public transport? Not very, to be completely honest. Quite happy to be in the office and want to go and see my colleagues, but actually the getting to and from. So I think that it's creating an anxiety within me as we get closer and closer to that. So Kimberly, I saw your hand up, so go ahead.
Well, actually, this is something I probably should have mentioned earlier. When we were talking, we also talked about the transition out of lockdown with people in the groups. And it really seemed like we almost got two categories of people to a certain extent. There were people who were just so excited about it and like were planning the first thing they do when lockdown lifted, and going to a pub and having a pint and, what they'd have for their first meal, and like were really excited about getting back out there. And then we had another group of people who were actually very anxious about it and were worried about, even when they started going out, that the virus would still be there. We know now that only 2 to 3% get immunity once they've had it. This is something that is out there, that is still out there, and we don't know when we're going to get it, immunization for it. So I think there's a group of people that are talking about having both health anxiety and social anxiety, like actually going back out there, interacting again. What is that going to look like? What is it going to look like? How safe am I? Who are actually quite worried about lockdown when it does get lifted. And we've really seen these kind of two different responses from people, I think, and of course it's a, continuum. I'm sure there are people in the middle of that too. But it's very, I know exactly what you mean. I'm in your category, actually, where I'm going to be a little bit nervous about, even when they say it's okay to go out, what I'm really going to do. I don't know how much I'm going to start doing, and I think that that's very important to talk about.
And I think, so something that's come up within some of my friendship groups actually is around is children. So we're drilling into children that they, that there's a virus out there, that they must wash their hands, they can't go anywhere near anybody else. If they go out on their, to go out for a walk together, they are not to come into contact, all of those things, because the message needs to be really simple and really clear to them so they understand. But then what happens when they do go back to school, or even when it's a lighter version of what we have now, and they are allowed to interact with people in some way? Are they going, how do you explain that to a child? Oh, well, all of those things we just told you that you couldn't do, now you can do a bit, but you still, it's must be so confusing. So I think that that I've got friends who are parents who are very nervous about how they're going to deal with that side of things as well, because they won't be able to explain it very clearly. So, and then another question, just probably one of our sort of last couple of questions really, is for you really, Kimberly, but also it's Dan Morley actually who's asked this one. He said, rest of the panel do chip in as well. To what degree do you think that people will be able to go back to normal when normal is either very far away or will not be normal as we used to know it? How are people processing the possibility of how things may never be the same? And he says, apologies for being bleak.
Did you want me to start out with that one?
Yeah, please. Yeah. Okay. And then it'd be great to hear some sort of personal thoughts as well, actually, from the others, but please do.
I think that actually one of the things that people are very afraid about is what's going to happen next, and that's what we're trying to capture now in our research. Really is kind of these feelings about the new normal. People have said that it's been said that social distancing is going to last for the rest of the year. In some form. What does social distancing mean for us? What does it mean for our lives? And people don't know. And that uncertainty, like I was talking about before, that feeling of loss of control and uncertainty is what leads to chronic stress, is what leads to physiological problems, not just mental health problems, but illnesses, physical illnesses, and I think that people are under a huge amount of strain because they don't know what's going to happen next. And I think social interaction is going to look very different for people for quite a long time here. And being able to wrap your head around it and understanding that your world has changed for the appreciable future, no matter what else we're dealing with. This is true for everybody, every single person, children, adults, is going to be hard. And being able to, I think, one of the things that really helps behaviorally is shaping. It helps cognitively too. So trying to kind of not be catastrophic in your thinking, to not be black and white in your thinking. These are things that can really help your mood. Instead, trying to find the kind of graded perspective. So yes, things are not going to look the same, but they are still going to be good. We're still going to get things back. We are still going to be able to do things that we're able to do. We are still going to be able to get some part of control back, and focusing on that, focusing on taking it day to day, living in the moment a bit more, accepting the new normal, right? Acceptance is a huge component, appreciating what you have, the spring, the flowers outside, what you can actually access. So I think that acceptance, trying to stay away from catastrophizing and trying to find that kind of day-to-day living and finding the positives can really help people in the kind of short transition. Obviously, I'm just doing it kind of, this is my perspective and my opinion on this, but some things that I think can really help based on kind of CBT literature.
Yeah, and sorry, can I just say really quickly, I think the value of relationship will be so critical as well, and there will also be additional strain on relationships because people will deal with it differently, and then therefore there will be judgment or a lack of understanding in terms of how people are. And again, just building that resilience and taking time to spend time on nurturing relationships and understanding that there's peaks and troughs, and understanding that communication is critical, and how are you respectful of how everybody's dealing with this, and relationship support, whether you're doing it on your own or through therapeutic support is going to be critical ongoing, because it's just such a massive part of day-to-day life. And if we don't have that circle of support around us, or that circle of support feels strained or difficult, or like they don't understand, then that just puts additional pressure on all aspects of life. And so yeah, just making sure to take care of relationships, whether it's just with yourself or with all of those around you, I think will be a critical part of trying to figure out what the new normal looks like.
Yeah, absolutely, Anna. No, thank you. And I think we're just sort of in the last probably last minute or so of the session, so I'll just mention a couple of sort of comments that we've received, and so in terms of apps, John, I was thinking that so Orca have curated a kind of apps library of health apps, and they rate them as well. So, and actually, if there are any sort of CCGs or GPs or anyone like that on the call, then actually you can contact them and they can effectively, they've got a service where you can prescribe an app to a patient. So I won't do a kind of sales plug for Orca, but Liz, who is the CEO of that, is fantastic and is doing loads of webinars at the moment. So if anyone is interested in that and learning more about that, then do check it out. Also the NHS apps library as well. We've had a sort of on a positive note, so intolerance of uncertainty is a feature of disorders such as OCD and worry disorders, and treatment often involves exercises enabling exposure of uncertainty. So there may be some unforeseen benefits to some of this. In those sort of cases, a few people have commented actually they are finding it really difficult in relation to children and fears about going back to work, and also having built up that really sort of fantastic relationship with their children who they may not actually see as often as they have done, and are kind of concerned about how they're going to maintain that connection. But I think as you said, Anna and Kimberly, and I think everyone's really sort of drawn on this point, is actually, you know, we're in this situation, there's not an awful lot we can really do about it. So actually, if we can draw some of the positives from it, which may be that you speak to your family more because you can now video call them instead of having to go and see them. It may be that you've decided to take up a new hobby, or it may be that you're getting to spend much more time with your children. But as you say, you know, we need to appreciate what's around. For me, I think that the trees and the flowers and everything look absolutely fantastic. I've never seen so much blossom in the spring. So you know, the world doesn't look too bad out there. So if we can enjoy and take pleasure from what we can, and try and control to the extent that we can what's going on, then I think at the moment that's the best we can do, and we shouldn't put too much pressure on ourselves to do too much more. Thank you everybody for joining. Thank you all for our wonderful speakers for speaking. Thank you for everyone who asked questions. I hope we managed to cover everything off, and this video will be, hello, there we go. I don't know if you want to put the live screen on to Kimberly just to say hello to her. That's lovely. Thank you, Kimberly. And this video will be recorded and published on YouTube. So thanks everyone.
Thank you.
Bye.
Thank you.
Thanks everyone. Bye bye.